Pleasant good afternoon, fellow Rotarians, friends, and specially invited guests, and welcome to this special virtual luncheon with our District Governor, District 7030, Mrs. Sonya Alleyne. I acknowledge the presence of some of our keynote speakers at this time, who you would meet shortly when I introduce them, other dignitaries, inclusive of a past District Governor, Lyle, and District Governor nominee Leslie, as well as participants international outside of our District 7030. My name is Bounty Suka, Club Administrator, Club Trainer of the Rotary Club of St. Augustine, Trinidad and Tobago. I have served as President, Assistant Governor, and currently a District Discussion Leader for the Rotary Leadership Institute Sunshine Division. I am indeed honored and delighted to be given this opportunity to serve as the moderator for this very important historical webinar on child obesity prevention on this date, the 4th of March, the anniversary of World Obesity Day, with the theme, Everybody Needs to Act. The 2022 campaign is the third unified World Obesity Day, when World Obesity members and allies come together to call for change. It builds on the success of the 2021 campaign with theme, Everybody Needs Everybody, which received unprecedented press and public support, reaching hundreds of millions of people around the world. Obesity is one of the biggest public health challenges facing the world today, affecting over 800 million people, with millions more at risk. It is a life-altering disease that increases the likelihood of comorbidities and doubles the risk of COVID-19 hospitalization. Yet, people living with obesity lack support and face stigma at work, home, and in the health system. To make change a reality, we need action at the local, national, and global levels. As I said before, this is a historical meeting in many ways. For example, it's the first time a district governor will be meeting policymakers, but I will leave this up to our district governor to share with you the other reasons why this is a very special webinar today. Before I hand over to her, our host, I want to take some time now to deal with some housekeeping matters. I hope you all have your lunch with you so we can all have a healthy, sumptuous family lunch together. I invite you to share in the chat box what you are having for lunch. This session is not set up for questions and answers, but feel free during the lunch to make comments in the chat box while our district governor is chatting with her special guests. And it is now time to introduce our very dedicated and inspirational district governor, Mrs. Sonya Alleyne. District Governor Sonya is an accountant with nearly 30 years experience. Her career has exposed her to several aspects of the accounting profession and several industries in Barbados and the Caribbean. She has covered audit, offshore insurance management, manufacturing, distribution, and most recently, non-governmental organizations. Sonya is the Chief Financial Officer of the Barbados Family Planning Association, Treasurer of the Breast Screening Program of the Barbados Cancer Society for 18 years. She's an active member of the Guyana Association of Barbados and is the wife of David, an insurance executive, and mother to Trista. Because of her passion for Rotary, for service, Sonya joined the Rotary Club of Barbados South in June 2004. She has been president of her club during 2012 to 2013, assistant governor 2014-15, district governor chair 2016-17, and several other local and regional positions in Rotary. She has been awarded Rotarian of the Year twice and the Vocational Services Award for her club, by her club, and is a Paul Harris Fellow. While firmly believing in being an agent for change, she still feels that there is much that we as a district have done well and should continue to do. And in that vein, Sonya's aim is to carry on the work started in the district, with particular emphasis being placed on the plight of the vulnerable in society, especially children. I consider myself to be fortunate to have met Sonya very early in my Rotary journey. We attended several different conferences, district conferences, presidents meeting, trained together as discussion leaders, but I especially recall our last encounter as district leaders for Rotary leadership training in Guyana, when there were some unexpected challenges. I was very impressed with her professionalism and her managerial skills while contributing significantly to a very successful program despite the challenges. She is definitely an exemplar of Rotary's motto of service above self. So it is with great pleasure I hand over to our district governor, Sonya, at this time.
Thank you so much, Val. Good afternoon. Good afternoon, everyone, wherever you are. I am currently in St. Kitts, sitting with my friends from the Rotary Clubs of St. Kitts and Lyamega. Today, I have with me Assistant Governor Francis Ann Satney, and of course, past District Governor Trevor Blake. They're the ones that are joining me now. Others are going to be cycling in and out while we have our lunch. Folks, I've never, like Dr. Hospitalist said earlier, I've never had lunch on Zoom. So this is a challenge. However, let me tell you what I'm having for lunch. Lunch today, it looks pretty, okay? Lots of colors. I have broccoli, it's garlic vegetables, broccoli and cauliflower. I have salad, which is lettuce, tomatoes, and cucumbers. I have a healthy, lovely potato salad, low fat, but delicious because I've had a taste, and grilled chicken. So yes, okay, it's Friday, it's Lent, grilled chicken is a no-no, but somebody's gonna forgive me for that. I haven't had chicken all week, it's chicken day today. So folks, today, this is a special lunch that we're having today. I have some fabulous guests, experts in their fields from across the Caribbean that will be joining me today. And I'm so pleased to have them with me for lunch. And they're going to be sharing what they're having for lunch as well. So our Childhood Obesity Prevention program is in its second year. And all 17 countries, 74 clubs within our district have adopted some aspect of the Childhood Obesity Prevention program. While we are doing what we do from Rotary, we also need to talk about how the policymakers are handling this situation in the Caribbean and what will they do to tackle the environment of obesity that we're in. As we talk about global and Caribbean public policies on childhood obesity prevention, we have invited a magnificent team to join me today. You'll soon meet them. Claudia Batts, Dr. James Hospitalist, Dr. Karen Gordon-Boyle, who is also a Rotarian, and I'm pleased to serve with her. And of course, last but by no means least, the Honorable Dr. Christopher Tufton, the Minister of Health and Wellness from Jamaica. Val, can you let our guests in and can you introduce them for us?
Sure, Sonia. But before I do so, I want to acknowledge the presence of District PDG from District 7020, Harish Ramchandran, and also our own PDG, Lara, as well as any other past district governors that are present here with us. So joining our district governor at lunch today is Ms. Claudia Batts. Ms. Claudia Batts has a master's degree in public health from the Imperial College of London and is an emerging public health professional with 4 years of experience in communication, advocacy, and policy. She is the Policy and Projects Coordinator at the World Obesity Federation, managing communication and dissemination activities for 2 European consortiums childhood obesity projects entitled Co-Create and Stop. She has developed 2 briefings and a toolkit for policymakers and youth, summarizing evidence with necessary steps and considerations to ensure the appropriate implementation of health-related policies. Ms. Batts elicits perspectives of young people into the strategic design and delivery of programs and policies, fostering partnerships and convening relevant stakeholders to ensure that public policy is more inclusive and equitable. She also manages 2 social media accounts and has hosted a podcast. Claudia was selected in 2021 both as a Salzburg Seminar Fellow and a working group member of EIT Health Alumni Network, where she works with multidisciplinary communities of entrepreneurs and innovators to advocate for equitable access to healthcare via digitalization and to build inclusive communities. She's also native to Turkish. Next, we have Dr. James Hospitalist. He is a citizen of Trinidad and Tobago, an accomplished public health physician with 30 years of experience in global public health in the Caribbean, UK, and the USA. A father, a grandfather, a lover of nature, and keen sportsman, he is passionate about improving the health of people and the environment through partnership. He is the mastermind of the 6-point policy package, public policy on child obesity prevention, and a strong proponent and advocate for the introduction of front of package labeling for food and drinks with the high-end black and white octagonal labels. He's the CEO and founder of Earth Medic and Earth Nurse Foundation, immediate past director of the Caribbean Public Health Agency, and former director of NCDs for PAHO and WHO. Following him, we have Dr. Karen Gordon-Boyle. Dr. Karen Gordon-Boyle is the program manager of the Health Sector Development Unit at the CARICOM Secretariat in Guyana and has been employed at the Ministry of Health Guyana for the past 23 years. She is an innovative and results-oriented leader who is steadfast, composed, and delivers structured action. A team player with well-developed interpersonal and communication skills. Karen has extensive experience in HIV and STI clinical and program management, proposal writing, and project management. She has worked extensively in HIV prevention and behavior change communication, targeting key populations such as gay men and commercial sex workers. She has extensive experience in program design, implementation, and evaluation, in strategic planning and management of chronic disease programs at the national level. She's competent in qualitative and quantitative research methods and experience in clinical obstetric and gynecological case management. Next, we come to our Dr. the Honorable Christopher Tufton, who is Jamaica's Minister and Wellness and Parliament for Wales and Catherine. Between 2008 and 2011, he also served as Minister of Industry, Investment and Commerce, and Minister of Agriculture and Fisheries. In recognition, Dr. Tufton has received numerous achievements such as RJR Gleaner Honor Award and Wellness. He was also the recipient of the influential Jamaica Gleaner Man of the Year Award in 2010. He was recently elected president of the Pan American Health Organization's PAHO 59th Directing Council, which convenes health authorities to determine the organization's priorities and policies. As Minister of Agriculture, he spearheaded the expansion of greenhouse farming technology and the creation of agro-processing facilities, and so redefined the sector's strategic importance to the Jamaican economy, repositioning agriculture as a business. The same drive and passion was exuded when he headed the Industry, Investment and Commerce Ministry, where his focus was in investment facilitation, international market competitiveness, consumer protection, and the creation of a climate of confidence to attract investors. After leaving government in December 2011, Dr. Tufton served as the co-executive director of the Caribbean Policy Research Institute, a University of the West Indies think tank, while also serving as an opposition senator between 2012 and 2016. Dr. Tufton is also a business strategist whose expertise includes international business and marketing strategy, specializing in foreign direct investment facilitation and the impact of public policy on industry. He has lectured and conducted business consultancy in Jamaica, the UK, and the USA in a number of areas, including international marketing, business strategy, and entrepreneurship. A graduate of the University of the West Indies and Georgia State University, he received degrees in management studies and marketing, respectively. He completed his doctorate in business administration at the Manchester Business School, University of Manchester in the UK in 2002. Dr. Tufton is married to Nadine and they have 3 children, Charles, Kimberly, and Ada. Brief bios. You now have some information about our presenters who will be sharing their expertise with us. At this time, I hand back the floor to our District Governor, Sonya.
Thanks, Val. So folks, you've heard them. You've heard that list of outstanding guests that I have today. I'm not sure that the Honorable Dr. Tufton is with us yet, but let me just welcome all of you, Rotarian Dr. Karen Gordon-Boyle, Dr. James Hospitalist, and of course, Claudia Batts from the World Obesity Foundation. It's World Obesity Day here in St. Kitts, and what a fabulous day to have lunch together. So, first of all, my guests, please, just the interpreters are going to have a challenge with us. So we need to make sure that we're slowing down our speech for them so that we get the message across for the members of our district. We have French joining us as well, French participants. So please, if we can slow down, that would be great. So let's get right into it. Let me ask all of you, I shared what I was having for lunch. So can we all share our lunch? What our plans are? What's happening? Claudia?
Sure. Welcome everyone and great to be with you all. I've got here, it doesn't look very pretty like yours, Sonia, but I've got Turkish vegetables for lunch. In Turkey, we have a lot, it's very common to do sort of courgettes mixed with rice and tomatoes, and it's a long sort of stewed dish. But it's quite late here in the UK. I'm based in London and it's 4:30, so it's a late lunch.
Late lunch, we're going to call that tunch, like tea lunch. Okay, great, that sounds delicious. James, tell me, you and I are struggling to eat lunch by Zoom, but please share what you're having.
Thank you, DG. Well, I'm having some fish, some ground provisions, which in Trinidad is a term for ground food, and some pumpkin and carrots.
Ah, delicious. And Karen, last but by no means least, what's on your plate?
I have to confess, I have here only half of what was supposed to be my lunch. It's a fruit plate, lovely tropical fruit. However, I was trying to get a chicken salad, but I was a bit too early. So I only have the fruit salad, but it's gonna do.
Listen, it all sounds delicious. I think all of us we're gonna eat and chew each other's food, and we're good. Thanks so much. Okay, so you've heard about our Childhood Obesity Prevention Program in District 7030, which is a priority for our district. And it has been a priority from last Rotary year under IPDG Lyle Chase, who was a pioneer in this area along with our very own Dr. Virginia and they conceptualized this childhood obesity prevention program, and we have carried it on. I have continued it in my year, and of course we have commitment from the next line in the line of governors to continue to make this a priority. We have a unique opportunity as a district and as leaders in our communities to really make a difference in the lives of our children and in the future as we start tackling childhood obesity prevention at an early stage. We are sure to make an impact. Maybe we won't see it in the next few years, but we certainly will see it down the road. So after 2 years, we now feel that we need to hear from at a policy level how this childhood obesity prevention can roll out into all areas, not just the Rotary Clubs, but how all our partners and the society on a whole can be influential in making this change. So during this presentation this afternoon, feel free, as you hear things, you may want to just jump in, just as if we were sitting together in a room as good old friends, having a good chat on a Friday afternoon over drinks. Healthy drinks, of course. So it's a virtual lunch, but let's make it as if we're all together in the same space. Claudia, I'm going to start with you because really and truly today is your day. Today is World Obesity Day, and in your organization, you are championing this cause. Tell us a little bit about who you are and what you do in the World Obesity Federation.
Sure, thank you so much, Sonya. And just to give some background to everyone on the line on the Federation as a whole. So we're a health advocacy organization that really aims to lead and drive global efforts to address, reduce, prevent and treat obesity. And I have to say that the majority of our work would not be possible without the collaboration with members. So we work very closely with national obesity organizations, but also very closely with when we're talking about sort of leading global advocacy for obesity with civil society members, but also UN agencies such as UNICEF and the World Health Organization, and not to say the least with people with lived experience of overweight and obesity, and more recently, more and more with youth. And sort of, I think for World Obesity Day itself, so this day is celebrated on March 4th every year since 2020, as was highlighted previously. And I think it really falls under the umbrella of our activities on advocacy, but also on disseminating knowledge around obesity. So this unified day of action is really an opportunity to call for cohesive responses to the pandemic. And I think so over the past few years, we've addressed a lot of issues from raising awareness around the root causes of obesity, increasing recognition of obesity as a disease itself, but also on weight stigma. And now I think it's really our opportunity this year to build on those conversations. And over the past decade, I'd be wrong to say that we didn't expand the evidence base on why we need to address obesity. And now it's really time to take that and transform it into action. And I think last year, particularly, the campaign was an opportunity to reach more, the public of it itself, and to really galvanize also to that work that we do with healthcare professionals who are managing and treating patients as well. So today we actually, for World Obesity Day, what we do is provide a platform for everyone to tailor the campaign, the resources to their needs. It's, we convene the campaign and we set the theme, but it's essentially, it's for everyone to adopt as their needs in their country. So we by no means take all the credit, and there's some amazing initiatives going on around the world. But what we have done today particularly to support countries, we've just released a new report called the World Obesity Atlas. And this report has new data on obesity prevalence, including childhood obesity across different regions and by country in scorecards. And just to give some key figures from this report, it really it spotlighted how, so at the moment there's 800 million people living with overweight and obesity across the globe, but this is projected to rise to 1 billion globally by 2030. But when we look at these rates, it's not at the moment, it's not just that, an issue of developing countries, but also developed nations as well. So the most rapid increase is actually we're seeing also, in Southeast Asia and in Africa. So it really is rising everywhere across the globe. But at the same time, and another concern is the rising levels of childhood overweight and obesity. And we have to acknowledge that there have been targets that were set back in 2013. The World Health Organization adopted some targets to halt the rise in childhood obesity. And this is, at the moment, we're not reaching those. So this is our opportunity to come together as a community to find solutions. And for me, it's been really inspiring to just watch everything unveil, especially in the Caribbean, just to see. I saw the press release this morning across CARICOM region and just seeing that cohesive support, I think is amazing. So that's a quick summary from me, but I'll, thank you so much.
Thanks, Claudia. So valuable partners all around. The Healthy Caribbean Coalition also joins in our advocacy, and we're very happy to have both you and them partner in this webinar and making somebody as valuable as you a part of having lunch with me today. Thanks so much. So James, you're next up. You're this rose among the 3 thorns here. You're representing. So you have a pretty impressive public health background. Can you share with me a little bit about what are your thoughts on this childhood obesity in the Caribbean, and how much of a problem is it for us?
Thank you, DG. Well, where to start? About 10 years ago, I came back to the Caribbean to lead the Caribbean Public Health Agency. And at that time, I'd been out for 7 years. I'd been the head of the PAHO program for non-communicable diseases. And when I came back to the region, three major changes struck me. One is what we call a demographic shift. The population was getting older. And we hadn't paid enough attention to that before. The second was the emergence of the non-communicable disease problem in children, manifested as childhood obesity. And the third is the overarching threat of climate change. And actually, the last two are connected, the childhood obesity and the environmental challenges we face. So you ask about the scope of the problem. And so that was my genesis in thinking we've got to do something about it, and raising attention to it and working on the 6-point policy package, which I'll talk about shortly. What I'd like to do is just share my screen for a second, if I can figure out how to do it, and shock you. I want to shock you with this picture. This is a picture I used to show. I got it from a colleague in St. Kitts and Nevis. And it's one that, if you live in the Caribbean, we're seeing more and more frequently. Young kids who are not normal. Now, this is not the child's fault. He doesn't buy his food. He doesn't prepare his food. And in talking about the scope of the problem, I have just this one slide to remind me what to talk about, which has to do with the prevalence and trends, the causes, and so on, and the costs. Now, Claudia mentioned just now, it's 1 in 4, 1 in 5, 1 in 3, depending on where you are, children who are overweight or obese. And the trend is going in the wrong direction, especially where the COVID epidemic of the last 2 years has been concerned, and kids are at home and they're not so active, and people are eating more and they're anxious. At the same time, we mustn't forget we have a percentage of children who are going to school when the day comes hungry because they don't have enough to eat. So this is a complicated issue, and we have to be careful not to blame children. Now, what are the causes of this? Well, it's not just calories in, calories out. We know now that there are a lot of chemicals in our food and in the plastics that are endocrine disruptors. They change the way your body stores fat, they change fat storage, they change your energy balance. And children who are guzzling a lot of these soft drinks and drinking water in plastic bottles, as some of us want to do, are at risk of that. The risks, of course, we live in an environment where we have a lot of high sugar, calorie, fat food, and we have insufficient environment for physical activity. It's unsafe in many places to be physically active as a child, especially if you're a young girl. You're at risk of harassment and physical damage. Let me say a word about the commercial determinants. These 10 companies control a humongous amount of what the world eats. These 10 companies control a lot of what the world eats. Nestle, Coca-Cola, Unilever, Danone, Mars, Kellogg's, PepsiCo, General Mills. You would recognize them. And if you dig into this graphic, you'll see all the different things that we are accustomed seeing on the grocery shelves and the shops that they control. And they are not pro measures that are going to change this situation. They make hundreds of billions of dollars, and they spend a lot of money on information and disinformation about this problem that we're dealing with. And that is why no country in the world has actually solved this problem at national level. I wish we in the Caribbean, with what Rotary is doing here, could actually spearhead a change in that, so that some years from now, we're able to say the Caribbean led the way in tackling this problem. Now, that's very nice sounding, but it's not easy. It's real hard. And part of the struggle is the commercial determinants. Let me say a word about the costs. First of all, the economic costs. A child or an adult with obesity faces a 50% lifetime higher health cost. And if 30–40% of your population are overweight or obese, your health minister and your finance minister are set up for more and more expenditure on health programs. The social security system will be creaking because young people who are sick and have to take time off work and payments for disability, they are not contributing to the social security system. In the workplace, a young person who is very overweight and obese faces stigma, faces discrimination. So that's on the economic side. When you think of the health costs, this audience knows diabetes, hypertension, kidney failure, heart disease, the list is long that a person who has a child who is overweight or obese has to deal with. What you may not have thought about so much in this discussion is the environmental impact of this. The amount of land that's cleared and grown for sugar with pesticides and fertilizers that are used and then go into the water system. The plastic bottles that clog up our drains and cause floods when you have the inundations or rain as climate change advances. They clog up the beaches and they pollute marine life, and they break down and leave microplastics, which you then ingest. And all of us now have microplastics in us. Coca-Cola and Nestle control a lot of the world's water supplies because they have to get water to make their drinks in areas that are poor and desperately in need of water. So I wanted to flag among the costs, not just the economic and the health costs, which this audience may have thought about, but the environmental impact of the things that are driving obesity or associated with obesity. So that, folks, is the scope of what we're dealing with. The problem is getting worse. No country has really turned it around. There are significant risks in the food we eat and in the amount of food we eat and the commercial determinants that are against us in many ways. Now, some commercial companies are positive. Those have fruits and vegetables and are pushing for locally grown stuff. Those are positive, and we'll talk more about that in the 6-point policy package for healthier food environments. Thank you.
James, that's a sobering introduction. I think seeing it in living colors really does make us step back a little bit and try and realize that as Rotarians, we've made the right choice, but we need to take it further. And we need
a lot further. This is a long journey, a common agenda. And I'll just repeat, there ain't no country in the world that has succeeded at national level to turn around this problem. So the problem we're tackling, if you look at anything, violence against women, if you look at, which is a pernicious problem, you look at alcohol, you look at firearm injuries, you know, you'll find somewhere that has succeeded and you can say, oh, here's a good example. But this problem, nobody has turned around at national level, unless Claudia has an encouraging correction for us. So it tells you that the problem is a wicked one, is a hard one to change. And if the efforts in the Caribbean can lead to change, CARICOM, Rotary, all of me now, I'm in an NGO. CARFA has a role, you know, many parties have roles in this, but this is not just the Ministry of Health problem. This is a complicated problem. Sorry.
Thanks. So you just segued right into the hands of Rotarian Dr. Karen Gordon-Boyle, who sits in the office in CARICOM. Karen, talk to us. Tell us what's going on. What is CARICOM saying? How are they dealing and treating to this problem?
Thank you, DG Sonya. So I totally agree with everything that has been said so far, and it is an immense problem, and CARICOM recognizes it as such. And for that reason, we had the, I think it's now famous Port of Spain Declaration in 2007, where the community came together and our ministers and heads of government all decided, you know what, this problem, the chronic disease problem, is significant enough for us to come together, sign the documents and say we're going to put this as a priority issue and ensure that we have both the financial resources and others to turn this epidemic around. Obesity is not only a cause for premature death. In fact, globally, they have estimated it can cause a 9-year reduction in lifespan. And the last 9 years of life can be not optimal. But not only can obesity itself cause a reduction in lifespan, but obesity is a precursor or a risk factor for some of the most prevalent chronic diseases, such as the hypertension and the diabetes. From CARICOM's standpoint, we look at health across the lifespan. So we're looking from prenatal, when a woman is pregnant, right through from birth, early childhood, adolescence, adulthood, and finality. And so we're looking at policies that need to be in place to address all the risks, and those risks we're talking about is the obesogenic environment, where you live, work, and play, and the options that you have. We're looking at your knowledge base and information that you have access to right through the life course. And for that reason, we've had a number of policies that we've been working on, but let me just say that we work in partnership. Because of the enormity of the problem, we recognize it requires a comprehensive, intersectoral, feasible solution that brings together partners that bring a certain amount of expertise. And that's one of the reasons why I'm really happy that, you know, Rotary has joined the bandwagon, because we have had, I think in 2017, we formed the Intergovernmental Working Group, Technical Advisory Group, I should say, and that has the FAO, Caribbean Agricultural Research and Development Institute, CARFA, CARICOM, CrossQ, which is involved with the development of our labeling standards, PAHO, and Organization of Eastern Caribbean States, and so on and so forth. But the idea is we recognize no one entity can do this alone. But I also want to recognize, even though CARICOM has a focus on policy development that helps to create an environment that's enabling for change, it really must have in partners, the Rotaries and the Healthy Caribbean Coalition, etc., who are on the ground, who can actually make this work. And so we have been looking at things like, if we look at early childhood development, so from the breastfeeding policies, we look at the baby-friendly hospitals that ensure that or promote exclusive breastfeeding for the first 6 months of life, recognizing that the babies that are exclusively breastfed are less likely to be obese, less likely to have obesity in childhood, as against children who are fed on formula. Now, this alone required a lot of work, because you would recognize that there has been a shift from our culture recognizing and embracing and seeing the value of exclusive breastfeeding to embracing the West and the more developed countries that have I would say embraced using complementary foods and using formula for babies, and partly maybe because of lifestyles, having to work, etc. But the point is, we now have policies where we accredit hospitals that promote exclusive breastfeeding and help to reduce the problem of obesity in childhood. And then we have the policies that look at the school environment. So when children go to school, what are their options for food choices? And so that you have the school-based, you have the food-based dietary guidelines, you have school policies, etc., etc. And then we look at the environments where children have to grow and play. So are there parks? Are there safe places where they can go out and play? We recognize that I think the Caribbean is sort of, most of our member states would be classified as either middle income or maybe lower upper middle income, but that's a transitional period, a transitional state I have to say. So we're not at the lower income where we would have, and in times gone by, most of us would have been engaged in very physically intensive labor. We would have expended and used all the energy and all the high calorie foods that we would have been taking. We would have had to use them from walking to work or walking to school, or just the labor intensive nature of our jobs. Since then, things have become mechanized. Since then, quality of lives have changed, and more people are driving to work. More people are using mechanized things to get the job done. And so there's less expenditure of energy, but our food choices and the way we eat haven't changed much. So for instance, during maybe slavery, you would have a lot of, the root vegetables, the starches, the rices and the flours, and maybe a little bit of protein on the top. I would look at it as a mountain with a cap. So there'll be a mountain of rice and a cap with a little stew on top and a little of proteins. Whereas in actual fact now, because our energy demand is so much change, we need to flip the way we put our portions on the plate. It needs to be a lot more proteins and vegetables and a lot less of the starches and the energy giving foods, because the demand for energy has changed so much. We also recognize that, the children in our changing environment spend a lot more time on their PlayStations and these electronic things that I say also help babysit them. And so parents actually encourage it. But the point is, they're not going out to play. They're not playing sports so much. And again, in the more developed societies where they do have all these electronic gadgets that the children play with, but the parents also have the time to take them to the swimming lessons and the other sporting activities, the footballs, etc. So they still manage to have that balance. So in our society, we have to have those policies that make, for instance, having timetabled physical education in schools, which is not happening in many schools, or may only have once a week, if you're lucky, physical education. And so that's the sort of things that we have to look at, as well as what's sold in the canteens, etc. And I think we'll talk a little bit more about that. But suffice it to say that we recognize that this is a huge issue. It has economic implications, as James would have mentioned. And so the policies that we have developed and are developing, the front of package labeling policies, etc., are all geared to help tackle the problem at the different points. I think I'll close off there.
So you touched on a lot of topics, and a lot of those topics mean that we're dealing with many, many tentacles in the society and in the sectors. So you talked youth, you talked health, you talked education, agriculture, finance, trade, industry. James touched on those. You know, how do we get to the next level? How do we incorporate have that conversation with all of these people at the same time, hearing what we're saying?
So I think from the CARICOM standpoint is setting the political will and having the policies to set that environment in which we have to operate. But then when the rubber hits the road, it's a question of having organizations like Rotary, like the Healthy Caribbean Corporation, the NGOs have to partner with government, and that way, I think we can actually implement some of the policies that we're busy writing. So it's a question of raising awareness. A huge part of what we have to do is raising public awareness of, oh, that there actually is a problem. So for instance, I can share with you, I was a child that for some reason, I can't tell you why, I rejected breastfeeding. And so I was actually bottle fed and I was a fat baby. And I remember, in fact, even now, my mom still refers to me as being fat and nice. It was something lovely. I was fluffy. So there was that notion in our heads that it's nice to be fat. It's nice to be fluffy. It's something positive. Now we have to re-educate ourselves that it's not necessarily the best thing for a child to be fat, because that puts the child at a much higher risk of being fat as an adult. And we know that the risks of being fat or overweight as an adult are quite a few. So we have to educate, raise knowledge and awareness so that people understand the issue of obesity and the implications down the line, not only for, as James would have mentioned, not only for a child that is overweight and the implications for their lack of activity, lack of self-esteem, possibly being taunted and teased, and the repercussions of all of that. But we also have to think about the long-term effects of obesity. And I really believe we will get nowhere unless we have organizations such as Rotary that are in the community, working with people, as well as the government, of course. We're depending on, for instance, our healthcare workers, our social workers to do the one-on-one teaching, to have public awareness campaigns, but it must be reinforced at another level. And I think it's the tentacles, as you like to refer to it, those tentacles have to be within the community that reinforce those messages that are given, let's say, in the clinics, or let's say in schools, because I know there's something called the health and family life education, where we are teaching about healthy living and healthy lifestyles, but those things must be reinforced at the interpersonal and community level. And I think there's a huge role to be played by organizations such as Rotary and the other NGOs.
Thanks so much. So Claudia has her hand raised, but I wanted to say, Karen, you talked about breastfeeding and, you know, how children that are breastfed are less likely to be obese and so on. That's only if all of those things are followed through with a healthy diet. Most times, those children are the ones that are eating the corn kernels and having the Coke for breakfast. So I leave it there. Claudia, tell us what's on your mind.
Yeah, no, I just wanted to echo and build on what Karen said. I think obviously, you know, there's a huge package of policies that need to be implemented in a comprehensive approach. But in addition to this, you know, policies can look great on paper, but number one, you need follow-up. You need to make sure that they're being evaluated and implemented properly, but also to galvanize and to build public support and trust. So, I mean, in the UK, just on a positive note to show what young people have been doing, particularly focusing on school environments. We've seen a big sort of a big group of youth activists who have actually been who've managed to successfully campaign for the government to actually enforce that school food standards are monitored and checked. So now that they're going to be, and this was just reinforced now in the last month, and that's going to be implemented. So and they're going to invest, I think, around £5 million, which is a lot into this initiative. So that includes also looking at sort of support for schools in terms of enhancing sort of cooking, but leadership and governance as well. And I think, you know, these, you know, schools especially, we need to make sure that even the provision, you know, the provision of food young people are able to actually get in the kitchen, to learn how to cook foods, and not just, because essentially they don't have control otherwise as, you know, what they're being provided. And we know that school interventions are, when coupled with initiatives at home, the training for also parents and caregivers is actually a really an effective way. And then I was also thinking about digital marketing, and obviously that's a huge challenge that we're facing as well. But at the global level, in the past year, we've seen you know, responses, both in the UK, we've seen responses to restrict marketing, but the World Health Organization recently adopted draft recommendations to address obesity across the life course. And these recommendations, there was a consultation period over at the end of 2021, and they were discussed more recently at the executive board, and now into they've just been adopted, and this gives us an opportunity to, and one of these recommendations was focused on marketing too, and they were generally a very comprehensive package. So we need to, I think, moving forward, make sure that we're all, you know, we're at World Obesity calling for a global action plan on obesity, because we see that there's so many initiatives going on everywhere. So there's, even within the same institutions, like the World Health Organization also working on an acceleration plan on obesity, which is looking at different countries, I believe around 25 countries, and what they're doing. But we need to make sure that these all come together, and that it's so that we can have a really comprehensive response.
Thanks, Virginia. In Barbados, the Ministry of Education has they have 6 pilot schools where they have gone in and fully endorsed a healthy lifestyle together with canteen operators. And something that the canteen operators did was invite the children into the kitchen so that they could teach them how to do these healthy foods, which really are just it was the same kind of food, but prepared in a healthy way.
Healthy.
The same chicken, but instead of it being fried, you're getting it baked, you know, and tasty, making the use of the spices and so on. Karen, I just want to go to James and his 6-point policy package, because we really, time seems to be running out on us. So I really want James to get in his on that, and the front of package labeling, if we can, and then I'll definitely come back to you once we have time.
Thanks, DG. Well, we've all been talking about how challenging the problem is, and so on, what can be done. So I will share my screen again and briefly show you something that about the 6-point policy package. If I can figure out how to get it done, let's see.
So that's my team. So I'm going to tell you that I've been joined now by the presidents of the La Amiga and St. Kitts Rotary Clubs. So I have a full room of cheerleaders here joining me for lunch. So.
Sorry, when you want it to work, it doesn't work. Can you see?
We're seeing something, yeah.
Yes.
See that?
Yep.
Okay, so thank you, DG. So this slide, I took about 2 or 3 slides here to just summarize what we need to do to promote healthy weight and prevent childhood obesity in the Caribbean. And this was work done when I was at CARFA with CARICOM and the team. and came up with this 6-point policy package. And you see at the top here in red, mandatory front of package labeling. This is the most important measure, and I will tell you why. So this 6-point policy package, first let me say it is evidence informed. We spent a lot of time and money researching what was promising in the world about how this can be turned around. Second, it is comprehensive. No single policy does it. Not labeling by itself, not taxing sweet drinks by themselves, not just the schools by themselves. You need a comprehensive approach. We drew on examples from elsewhere, and the policy also includes a detailed list of the implementation considerations. I mentioned in the previous slide, the most important measure is mandatory front of pack nutritional labeling with a simple stop sign that we've seen elsewhere in the world, particularly Chile and Ecuador, that's extremely effective in giving consumers a sign. This food is high in salt, sugar, fat, or overall calories. It ain't got green and red and yellow and all kind of things to confuse people. It just has one stop sign, very clear, very simple. You can still buy it, but you're warned. It is high in salt, fat, sugar, or overall calories. And that's why industry doesn't like it. They want more confusing and nuanced systems. But this, from all the evidence that we've seen elsewhere, this is the most effective way to empower consumers and mothers who are buying food for their children or for themselves about the quality of the food. Now, why is this the lever in this policy package? Because foods that are high in salt, fat, sugar, or overall calories may not be in schools. You cannot market it in the school, and neither can you advertise it and market it to vulnerable groups. Such a standard in place then forces the manufacturers to think, okay, I have to reformulate. I have to reduce the salt and the fat and the sugar in the food. And it encourages the food chain incentives for those who are producing the local foods and the fruits and vegetables and so on. And that's why I say that is the most powerful lever in the suite. It's why industry doesn't like it and why they're opposing it in various ways. Mandatory front of pack nutritional labeling. If there's one thing Rotary should advocate for, it is that, because it empowers consumers. It is something above a childhood obesity issue. When we were down in Chile some years ago, Healthy Caribbean, ourselves, PAHO, CARICOM was there. The president of Chile came and said, this is more than about nutrition. This is about reclaiming, this is about the rights of children and the rights of people to a healthy environment. There are a lot of considerations in doing this. I talked about the fact that no country has solved it. It has a lot of costs, economic, health costs, and environmental costs. And we want to start with the children. It's not a single magic bullet. You need policy, you need education, you need the health services to be involved. It requires government leadership. We must tackle the commercial determinants and the conflicts of interest. We need to, Rotary could do a good job by helping to educate people on what is the meaning of conflict of interest. How come Nestle is in bed and funding so many of the nutrition and dietetic societies in the Caribbean? How could that be a lack of conflict of interest? The consortium of economic and social sector institutions that Karen mentioned earlier is quite promising to help to solve this problem. And then folks, DGU asking, what does it take? Well, these are 3 universal requirements of any kind of policy. You've got to have the policy and the law in place, such as mandatory front of pack nutritional labeling. You must promote it, you must educate people, train people, you must have enforcement and monitoring. Those are 3, whether it's seatbelt laws, or you're dealing with the food environment, these are the 3 universal requirements. Thank you.
Thanks, James. So front of package labeling has been a buzzword for a long time. It takes such a long time to get these things to come to any kind of meaningful decision. Karen, I'm leaving it to you to jump in here because I think that you have some contribution there.
Yeah, and let me start by saying, in all of this, we aim to make the healthy choice the easy choice. That's the bottom line. So even with the front of package labeling systems that we're looking at, the idea is that anybody must be able to pick up a packet and know, is this healthy? And if it's not, what is it that's in it that's probably going to be dangerous or not good for me. And the front of package labeling system that we recently considered last year was what they call the monochromatic system. It is just one color and it says either high in salts, high in sugars, high in trans fats. And those are the things that we want consumers to know about. And that is something so simple that even the children can be taught how to look for these signs and know to tell mommy, as someone from Chile who was sharing their experience said, children are going into the stores now and telling their mother, no, mom, you can't buy this because it's high in this or high in the other. So it can be that simple so that even a child can tell you what's right and what's wrong in terms of what to purchase. So it's a system that we definitely need to move. We had the cross-Q last year sending out that system of labeling for voting amongst our CARICOM member states. And guess what? We did not get the required number of votes. You'd think it's something that's simple and straightforward and there should be no problem. But when you have industry managing to infiltrate those little committees that do that voting, we have a problem. And that's exactly what has happened. So we need to have national institutions, ministries of health, Bureau of Standards, vetting and ensuring that those people who are sitting down and casting those votes have not been infiltrated, or else we can make all the policies we like. We're not going to get them passed because of the infiltration by industry. So the bottom line, as James would have said, is ensuring that we simplify this and we make healthy choices easy by also putting taxes on the foods that are calorie dense but nutrient poor. So the foods that are not so healthy should be more expensive, and the foods that we wanted to promote should be cheaper, affordable, and available. And so, for instance, in the schools, the canteens, and even those ladies that sell, I don't know if it's the same around all the Caribbean countries, but for instance, in Guyana, where I grew up, you have the school official canteen, but you also have the ladies around the schoolyard or just outside the school gate who are equally as popular, who sell, you know, syrup, mango syrup, and all the other syrups and all the other fried stuff that the children like to go out and purchase. So we have to look at not just those policies, but also how to educate those vendors on alternative things that they can sell. The idea is we don't want to put anybody out of business, but we can educate them on alternatives. So they can be selling fresh fruit and other healthy alternatives that the children can equally purchase. So it's working with the people, working with society, working with community, working with the schools to ensure we enforce those things. And as I said, it could be a fun thing as well. So, you know, getting children to be more active and mobile could be just enrolling them into clubs, sports clubs. So it's a sporting event, something that they can be competitive, something that they can enjoy, but it's changing values, value systems, changing lifestyles. We recognize that doesn't happen overnight, but it's important for us to set the right environment. And that even includes this infrastructural environment. Because if you're living and working in a place where there are no facilities for no gyms, no safe places where you can cycle, or if you decide that even though I have a car, I'm fully aware that I need to be more mobile, and therefore 2 days a week I may want to use my bicycle to get to work. But guess what? The roads are not safe. There's no area on the road for me to cycle safely. So those are the kind of things at policy level that we need to look at to ensure that we create environments where physical activity becomes easier. For instance, even workplaces in the more developed countries, workplaces have gyms right there in the facility. So you can actually go work out, have a shower, and be back at work. So again, those are the little things that we can use and put in place to make it easier for persons to make the healthy choice, the easy choice.
The thing is, you know, you say all of those things, but the cry is always going to be, we don't have the money. The majority of people who are at the lower socioeconomic level are going to say, that's all well and good, but my pay packet only goes this far. I don't have the money to do extracurriculars. I don't have the money to do all the healthy foods, but we have to, as an advocacy group, change that narrative, because in the Childhood Obesity Prevention program in our district, we have been able to show many people how you can have healthy food in your own backyard.
Thank you.
And you don't need an extracurricular activity to go run around in a field instead of sitting in front of an Xbox or whatever.
Exactly. It doesn't have to cost more. It's just a question of changing the value system, right? Changing the way we think, and a parent telling you, put down that Xbox or whatever it is and go out and play. And like you said, having your kitchen gardens, and at a government level, you can incentivize the farmers so it becomes cheaper for them to produce the fresh fruit and vegetables. And like I said, you can generate income, you can generate revenue by putting increased taxes on the foods that are harmful and the foods that you don't particularly want people to be using so much of. So if the unhealthy foods become more expensive, there's going to be decreased demand. This is the economics, right? Demand and supply, but being decreased demand for the more expensive foods, which are unhealthy, and you can subsidize the healthy, fresh fruit and vegetables, etc., and make those cheaper. And likewise, if the fast foods are the things you want to discourage, then you have to look at maybe the cost of such things as against the healthy foods that you want to encourage.
But we also have to bring those people along, because those fast food places are also employers.
Yes.
Of hundreds of people.
Exactly.
So we can't say fast food places, oh, you cannot have fried food. Why? We need to work with them to bring them onto our train of thought.
Yes.
Just have to do with those vendors outside the schools and say, look, this is what you're causing. This is the problem. All these diabetics with amputations,
Yeah.
all these people who have high blood pressure, it has become a problem since we have been using your products. How can you help us? So I just don't understand why those chains are not willing to, and those big conglomerates are not willing to spend the money to save the people who are going to spend money with them.
Mighty dollar. It's cheaper to use some of those trans fats, and even when you start off with an oil that may not be a trans fat, repeated heating can cause them to generate. So that costs money, right? So it's working with those industries to look at alternatives, alternative formulations that taste maybe equally as well, maybe a little bit more expensive. But I think even as we are working right now on a policy to eliminate industrially produced trans fats from the region, because we're seeing them as contaminants, and we're taking a page from the book of Canada. This is the approach Canada used to get rid of their trans fats. So that's the policy line that we're taking. But what we're going to do, or what we propose to do, is to give industry about 2 years to work with them to figure out the reformulations. How else can you produce what you have to produce, or what alternatives can you use to stay in business but protect the health of our people?
So I don't think that we're going to cover all and solve all the issues of childhood obesity in this one webinar, but I really think that this is a good start. I have thoroughly enjoyed the conversation. James, your slides really made me think, and I guess that's what they were meant to do. And to each of you, the contributions were invaluable. As we sit here today, Rotary definitely in District 7030, and I say 7020 as well. We are in this for the long haul. This is our fight. Our children are our future, and we need to make the necessary noises to those who can hear and who won't hear. We need to open those doors. We need to knock on doors and start having those hard conversations on how we look after the future of our nation. This afternoon, I'm sorry that Dr. Tufton wasn't able to join us. I get messages that he's still going to join, but I'm not sure when. But I would say that as it's a first conversation today, but we need to continue. We need to have more. Claudia, thank you so much for joining us from the UK, having your
Thank
late
you for having me.
with us, providing the insight, and for allowing us to piggyback on your celebrations today as a district. From being here with us, giving us your side of where we stand as in this fight. And of course, Dr. Hospitalist, your 6-point policy plan. We obviously need to have those voices raised and those points brought to the fore. And Karen Rotarian, Karen in CARICOM, as you open the doors, because I've had really good discussions as district governor. I'm in a really special position of meeting leaders and having the conversation, introducing our Rotary District 7030 Childhood Obesity Prevention Program to the governments. And everybody is also excited, but we need to move it from conversation and a promise to actually delivering. Claudia, I see your hand is raised.
Yes, I just wanted to thank you for this opportunity and this conversation once again. And to me, it was inspiring to see that, I think, the challenges that, we face here in the UK are very much the same, and we're all advocating for the same policies, which makes us a lot stronger together. And I just wanted to share and invite everyone, and I'm going to share the link in the chat, but we've launched an open letter to policymakers, which we are receiving signatories from, both from organizations and from individuals. And this is really calling on this sort of global, coordinated and comprehensive response to obesity that we need, because obviously we clearly saw that the system that is very complex, and we need a very large policy package, and we don't want to lose this momentum. And I think it's really valuable to have this collaboration, and I'm really grateful for all these conversations with you all.
Great, thanks, Claudia. So the moment that we've been waiting for has arrived. Dr. Christopher Tufton has joined us. He has agreed to fill right in. So Dr. Tufton, we've been waiting to have a chat with you. Thank you so much for joining us.
Thank you.
I'm sure you're not having lunch.
Thank you very much, Madam Chair. Thanks to my colleagues. Apologies profusely for the wait. I'll only be 3 minutes if you will allow me, and then I can answer any questions or comment otherwise. I actually thought it was 1 o'clock my time, so I thought I was 45 minutes early, but I'm actually very late. So I think this is a very germane, very important, very relevant issue that is being discussed, and I want to commend the Rotary organization for putting this together, for calling on all the sort of experts who are in the field, who are doing work trying to advance both education on the subject of obesity, but also lobby for and push for an approach to dealing with it. Jamaica is not unsimilar to the Caribbean region, and indeed the world. I've been Minister of Health for 5+ years. And my mantra has been, as a behavioral scientist, I'm not a medical scientist, and my doctorate is in business. I've always felt that the challenge that we face lies in our behavior and the choices we make. And in a sense, sometimes we don't have as many choices depending on our environment. And that is something that we as policymakers need to address in terms of creating an environment that can nudge and ultimately influence behavior towards healthy lifestyle, healthy living, and by extension, to rid ourselves and our country and our people, respectively, of obesity. So it is a big problem, 800 million people living with obesity. I'll go straight to Jamaica. We have some 68% increase in childhood obesity over the last 7-year period. 1 in 2 Jamaicans, or 54%, 15 years or older, are overweight. And that statistics, I won't give the other numbers in the interest of time, reflects the challenges around premature illness, the challenges around lifestyle among our young people. And the school system, in a sense, has evolved over time to create that environment that, in a sense, promotes the lifestyle and the behavior that enhances this real challenge we face. So for us, our intervention that we have taken on over the last number of years, and we believe collaboration and partnership is key in this regard, hence the relevance of a discussion like this, are as follows. We have started to initiate a sugary drink restrictions in schools. That started a few years ago, and it's continuing. Met a lot of resistance, of course, from industry, and that's an ongoing challenge. I just signed up a policy document to go to cabinet jointly with the Ministry of Education around school nutrition policy, which will mean what our cafeteria prepare for the kids, so the meals that they are exposed to in that very captive environment. Because again, they go to school, they have to eat lunch. You want to give them options and give them healthy choices. We have a program called Jamaica Moves, some years old, and there's one targeted at our school system to get our children moving again. The downside to technology clearly has been that they spend more time on the computer looking at the screens, whether they're phones or otherwise. And I may be repetitive here because I'm sure some of you would have mentioned this before, but it does create for us as policymakers, as leaders, a challenge, because as a result, they don't run around, they don't play, and the consequences of that are quite obvious. So we have joined forces with, the various stakeholders, PAHO, CARFA, CARICOM, WHO, doing so now with you all to really bring awareness through our lifestyle surveys, which draws the parallel or the links between obesity and the health profile of our population. And hopefully by doing that, using that information to create further baseline studies around the extent to which we have trans fats, salts, sugars in our population, in our foods. We have actually commissioned those studies. We have gotten back the trans fat studies, and we are now planning to meet with industry, because I am of the view that some of them might not even know that they have trans fats in their foods, even though trans fats are banned in many countries that they trade with. The salts and the sugar studies we're waiting on, and we are trying to champion, with much resistance, front of package labeling to give consumers the right to know what's in their food. And that, I believe, will need to be a collaborative effort, because again, industry puts a lot of effort in trying to maneuver around this kind of debate and discussion and ultimately policy direction. I'm going to stop here because I know I'm very late, but I just want to again endorse the efforts of Rotary and others who are on board online. Jamaica is committed to this fight, this struggle. We have some initiatives that are on the way and others to come, and we look forward to coordinating with you all in whatever way, shape, or form to champion this cause. Thank you very much, Madam Chair, and apologies again for being late.
Thank you so much, Dr. Tufton. I want to say that you were just spot on. You joined at the right time, because that's the kind of conversation we were having just before you entered. So you were timely. And thank you so much for taking time out of your busy schedule to join us on this. My question to you, so you've gotten all of these things done in Jamaica. What's the conversation like with the other ministers of health at CARICOM? How are they emulating what you're doing? And not just ministers of health, the ministers of education and youth. How is that conversation going? And are we closer as a region to having a policy coming from CARICOM on this?
Well, CARICOM does have an initiative around the front of package labeling, for example, and also through CARFA discussions at various levels around the need for increased physical activity, the need to manage the NCD crisis that we face, and it is indeed a crisis. 75% of deaths linked to NCDs or lifestyle-related diseases. A lot of that, of course, is a nutrition issue, alcohol, tobacco, and of course the foods that we eat, salt, sugars, fats, and to a lesser extent, I would say, lack of physical activity. So that discussion is an ongoing one, and at the level of ministers of health, we have been able to share with one voice the need for action. The Jamaica Moves initiative has been adopted as a Caribbean Move initiative. Recently, the name was officially transferred to CARICOM, so it's now up to CARICOM and CARFA to initiate. It has been launched in Barbados, was launched in Trinidad, St. Kitts and Nevis. So, there are countries that have started to pick up. Now, COVID has been a great disruptor of the programs. And what I'm hoping for is that the lessons from COVID, which is that persons with, obesity challenges or NCDs have been the most vulnerable. They are the ones who have ended up in hospitals and unfortunately have died. That message can reinforce us getting back to the basics around lifestyle and choices that we make and laws and policies. So I certainly, for one, as a minister, plans to advocate. I believe my colleagues in the region are similarly so inclined. The one obstacle we face is really the juxtaposing the need for lifestyle against the economics of survival. The argument is being made a lot that health is costly. To eat healthy is costly. And so one of the narratives that we need to champion is to really get or provide alternatives to this narrative that if you are to make choices that are more in your best interest as a health is concerned, it means you're going to have to spend a lot more. And, I've always said to people, I prefer sweet potato to rice. And we are a farming community, CARICOM, that is, complex carbohydrates. And, you could go on with that narrative. There are stigmas attached to some of the local produce, even though it's far superior from a fresh perspective and otherwise. So I think we have to join hands more with ministers of agriculture around eating what you grow, growing what you eat, around industry in terms of processed foods and the impact of processed foods and what the alternatives are. And it has to be based on the science, but I do believe too, we have to become greater advocates for these causes because industry spends a lot of money to advocate. And oftentimes we don't do enough of it. And the science alone is not going to make the argument. We have to be articulate, we have to be charismatic, we have to get into the optics, we have to show the data, the evidence, we have to package it. Now, I must admit, my expertise is marketing. So I am considered to be the optics guy in my country. And they say I'm the PR minister, but I have no problem with that because if you can't communicate your message, then it gets nowhere. And so we believe, I believe in that. So the short answer is, in summary, I think we have more work to be done. I do believe we have recognized that the problem exists. I do believe that COVID has been a major disruptor, but it now is a potential opportunity to reinforce the points. And I would like to see, in the interest of building resilience coming out of the COVID experience, a more aggressive agenda around lifestyle and lifestyle-related diseases. Thank you, Madam Chair.
Thank you so much. I'm not even going to ask you about KFC and all those fast food chains that don't seem to want to change and help our population change our lifestyles. I'm not even going to ask you that because I know that that's going to take another 2 hours for us here because I can see James chomping at the bit and Karen is ready, and as is Claudia. So thank you, Minister Tufton. Thanks so much for that, your contribution today. James, I'm going to give you like 2 seconds to wrap up, and I'm going to give Karen the same so that, you know, we would have brought it all together and we would have had an informative time today. You need to unmute.
Thank you, DG. Great to see Chris Tufter on this panel. He's been leading a charge in Jamaica. You know, it took Chile, which is an exemplar to the world. It took them 7 years and it cost $2.5 million just to introduce the mandatory front of pack labeling. So it's not an easy struggle, but we have to persevere because the costs of the existing system, we can't sustain that. The health minister and the finance minister and the population, the suffering. So when we talk about, you know, cost to people, we have to look at that side of it. Thank you.
Thanks so much. And Karen, you've got the last word in this webinar today.
Just to say congratulations to District 7 to 30, to Rotary for organizing this great webinar, to recognize Minister Tufton and the exemplary work that they have been doing with Jamaica Moves. And now I'm happy to say, as he mentioned, we now have CARICOM Moves. So we're looking forward to doing as Rotary is doing, having our across the Caribbean, having CARICOM Moves and ensuring that the word gets out and that, you know, our young people, starting from the little toddlers up to the older people, are active and moving about and just recognizing the importance of being more active. So kudos to you. And I'm hoping this is just the first of many more to come. Congratulations.
Thanks so much. Thanks, everybody. So this webinar today, we decided to piggyback on World Obesity Day to link our district Childhood Obesity Prevention program and this global campaign. Minister Tufton, you talked about Jamaica Moves, but most certainly District 7030 Moves for Childhood Obesity Prevention. That is one of the initiatives that we came up with this year. It's a district-wide campaign which involves all of our Rotary family, friends, and supporters to join us in having healthier lifestyles. We kicked things off in January with 70 moves for 30 days. And from the 20th of January, we had all kinds of activities. The competition was fierce. We had this app called Count It. People across the district and beyond were doing these challenges and steps, and every day you were monitoring to see where you were on this whole thing. And the energy around that campaign was tremendous. So to commemorate World Obesity Day, we had this webinar hosted by District 7030 in conjunction with many of our partners. And we could not have done it without them. We needed to highlight our partners and the causes all around childhood obesity prevention. To conclude our campaign, which will conclude on Sunday, a Rotary Day of Service, we have launched, it will be our launch of the 7030 Everybody Needs to Act campaign for us. We're going to be having, we're saying that this movement day on March the 6th is going to be hopefully an annual event that the district will get involved in around the World Obesity Day. We need, as leaders in our communities, people of action. While we serve to change lives, we need to take this seriously and imagine Rotary as we move to the next level. I thank you so much for joining us today. Rotary 7030, let's move. Thanks for joining, everybody. See you next time.
So I think it's my turn now, Sonia, to give a vote of thanks.
Oh yeah, sorry. I'm supposed to hand over to Val. Whoops, sorry. Not
That's okay. You have made my work very easy because more or less have summarized all the important points. So I will just very quickly do what I am supposed to do with respect to thanking everybody. So on behalf of you, Sonia, and our district lead for the Child Obesity Prevention Program, Dr. Virginia Assin-Osberg, I extend heartfelt gratitude to everyone who has contributed in any way to the success of our webinar today. Thank you to our very special invitees, the policymakers, for taking time off your busy schedule to share with us today your knowledge and expertise in relevant areas pertaining to the issues involved in child obesity prevention, with specific emphasis on making laws and policies with the ultimate goal of effective implementation towards significantly reducing the incidence of this complex disease in both children and adults. We wish to thank Ms. Claudia Batts for giving us an insight into the workings of the World Obesity Federation and the policies and guidelines instituted by this organization. Thank you for sharing with us a short extract from the new report with updated information on the prevalence of obesity and the projections. And we are happy that you have embraced the opportunity to collaborate with us. We also heard from the Honorable Minister, Dr. Christopher Tufton. We're sorry that you joined us so late, but very much appreciated of your contributions. We are happy about the policies that have been recommended and instituted at the governmental level, and how these policies would benefit not just childhood obesity, but the entire country. Thank you for taking the initiative and lead for this campaign. And we are grateful that you have endorsed the effort of Rotary. To Dr. Hospitalist, wow, what a wealth of experience, certainly opening our eyes to the extent to which the problem of child obesity affects the entire Caribbean. Thank you for explaining the 6-point policy package and how it can be successfully implemented, and the role, of course, of Rotary, the role that we as Rotarians can play in this regard. And Dr. Karen Boyd, who informed us of the policies and programs being instituted at the regional level, for your explanations of the role of CARICOM in bringing the related policy issues to the attention of our political leaders, and the way that it would be beneficial to the people. We hope this is the beginning of a long-term partnership, either collectively or individually, towards supporting our district with the Child Obesity Prevention Program. Child obesity prevention is a key priority for District 7030, and collectively we will continue to take actions to a higher level. Thanks for your recommendations, Karen, on how to make the healthy choice the easy choice. Our sincerest gratitude to Sean Paddy, our District Communication Officer, for his technical assistance, working behind the scenes to ensure that our meeting ran smoothly. Now, although I said that I was giving this vote of thanks on behalf of our District Governor and the lead of the Child Obesity Prevention Program, I really want to thank our District Governor for being such a gracious host, and Dr. Virginia, who worked assiduously, really planning this webinar and seeing it through to its successful execution this afternoon. Finally, to all the participants who attended and contributed to the success of this meeting. Thanks again, all of you, and have a pleasant, safe, and healthy weekend.